Hello and welcome dear viewers to the video on accelerated stability condition. The main focus of this video is why we have to perform stability study at accelerated conditions and what is the importance. As we know that product will never be stored at accelerated conditions, for example 40 degrees Celsius temperature and 75% RH and other accelerated conditions which are never recommended for the product storage. Generally, formal stability conditions are accelerated condition, intermediate condition, and long-term condition. Accelerated condition is studied for 6 months or the product is stored at accelerated condition for 6-month period and intermediate condition for 12 months period, and the product is stored at long term condition for 24 months period, and this long term period can be extended to study the effect of long term storage onto the drug product quality attributes. Now if the product will never be stored at accelerated condition by the patient or when it is in the market, then why we have to perform accelerated stability condition studies? See, generally that increase in the temperature, increase in the humidity, and increase in the exposure to light may enhance the degradation. Mainly the temperature rise by 10 degree compared to the long term and intermediate condition may increase the rate of chemical degradation and also may cause physical change of the drug. That's why the accelerated conditions are studied for stability. Then accelerated stability conditions are the part of formal stability study, and these studies are required for shelf life period determination and expiry period estimation. Generally, accelerated conditions, as it is done for 6 months, so it is a shorter duration study. It has high stress condition like in higher temperature, humidity, which may enhance the degradation of drug product or drug substance. Intermediate studies are generally performed for 12 months and long terms are performed for 24 months, and these can be extended. Generally for oral formulations which are required to be stored at room temperature, for those products 40 degrees Celsius and 75% RH is the accelerated condition. Then 30 degrees Celsius 65% RH is the intermediate condition, and depending on the climatic zones, the long term condition may be 25 degrees Celsius 60% RH or 30 degrees Celsius 75% RH. So these are the general stability conditions, and the accelerated condition may vary depending on the storage condition. So if the product is recommended to be stored at 25 degrees Celsius, 20 to 25 degrees Celsius, then for those drug substances and drug products, 40 degrees Celsius and 75% RH becomes the accelerated stability condition, and the storage period is 6 months. If the product is recommended to be stored at a refrigerated condition of 2 to 8 degrees Celsius, then 25 degrees Celsius and 60% RH becomes the accelerated condition. You can remember this by, if the product is required to be stored in refrigerated condition, then the room temperature will become the accelerated condition. Then if the product is required to be stored in freezer condition, -2 degrees Celsius to -10 degrees Celsius, then 5 degree becomes the accelerated condition. And for all these type of accelerated conditions, 6 months is the period for storage. Now come to the importance of accelerated stability condition. So these studies are done to predict the stability of the drug substance and drug product. So to predict the stability profile, the accelerated condition stability studies are performed. Then prediction of the shelf life and expiry period. By storing the product at accelerated condition for 6 months, the data is generated in a shorter period of time compared to the intermediate condition and the long-term condition. So in a shorter period of time, data can be available for shelf life prediction and for filing. Accelerated stability condition is must for regulatory filing for any of the market. The formulation strategies can be screened and the best formulation can be selected considering the stability of the same formulation or drug substance at accelerated stability condition. And by the data from accelerated stability condition, the data for intermediate condition and long-term condition can be predicted or extrapolated. That's why this condition reduces the development time. Extrapolation can be done to predict the drug product CQAs like assay, dissolution, water content, then impurity profile, and any degradation type of impurity. Accelerated condition gives the indication for any physical change or physical problem in the product or change in the description of the product or product container. Then accelerated condition can be done at R&D to predict the reasons for significant changes. For example, loss in assay by 5% from the initial value or change in the dissolution profile. Accelerated stability condition, including the other stability conditions, are performed at the R&D phase, at the filing stage, and also after the approval of the product, that is post approval changes. So this is regarding the accelerated stability condition. The main importance of accelerated condition is it is predictive of the formulation changes due to storage at higher temperature and humidity, and it is predictive of the significant changes or change in the drug product CQS. So this is regarding the importance of accelerated stability condition. I hope you might have got good understanding out of this video. Thank you for watching the video and please do like, share and subscribe to this channel.